Welcome to this webinar, which is presented to you by the team from the Weight Management Service at CHFT. The team throughout this webinar will provide you with information about what our specialist weight management service may be able to offer you. People are referred through to our service by their GPs, local weight management services, specialty doctors or surgeons, and other healthcare professionals. If your BMI is above 40, then you can be referred directly to our service. In certain circumstances, we may be able to accept people with a lower BMI. If you have been diagnosed with type 2 diabetes within the last 10 years, or if you are of a South Asian, Chinese, other Asian, Middle Eastern, Black African or Afro-Caribbean family background, then we may be able to accept a reduced BMI. We will cover a lot of information in this presentation, which will last just over an hour. We ask that you please take the time to watch the presentation, as it will provide you with valuable information to help you make an informed decision as to how you may progress within our specialist weight management service. We will talk about the use of GLP-1 injectable medications and also the types of weight loss surgeries that are offered at Calderdale and Huddersfield Foundation Trust, and what might be the correct pathway for you. If you decide that weight loss surgery may be for you, we will talk about the impact that surgery will have on your life going forward. We will also talk about valuable changes that you could start making now. In this next section of the presentation, we will talk about GLP-1 medications. GLP is short for glucagon-like peptides, and they've been around for over 20 years now. The first GLP-1 drugs were approved in the early 2000s to treat type 2 diabetes. Doctors noticed that, in addition to lowering blood sugars, people often lost weight also. Liraglutide, which is Saxenda, was the first GLP-1 approved medication specifically for obesity treatment in 2014. Over time, these medications were improved to last longer, so patients could take them once daily or even once weekly. Because they reduced appetite and helped people feel full sooner, newer versions were approved to treat obesity, even in people without diabetes. Today, GLP-1 medications are widely used to help manage blood sugar, support weight loss, and improve overall metabolic health. GLP-1 is a naturally occurring gut hormone which is released after you eat. It promotes satiety, which means it helps you to feel full, slows down gastric emptying, and plays an important role in blood glucose regulation. These effects help regulate appetite and overall energy intake. What GLP-1 medications do is to mimic the body's natural GLP hormone. Patients taking GLP-1 medications will have a reduced appetite, so will eat smaller portions and fewer calories without feeling deprived. Food cravings reduce, so you'll think less about food. The GLP-1 medications may also improve insulin sensitivity and metabolic health. We will talk about the GLP injectable medication called Mounjaro, as this is the medication that we may be able to offer to people within our service who meet current prescribing criteria. Mounjaro, or tirzepatide, is unique in that it works on 2 appetite hormones instead of 1. It activates both GLP-1 and GIP receptors. This dual hormone mechanism leads to greater appetite regulation and metabolic improvement, which is why many people see greater weight loss compared to its predecessors. Mounjaro is an injectable medication which you inject yourself once a week. If you qualify for Mounjaro, you will be started on the first dose of 2.5 milligrams, and our team will titrate the dosage up until you reach the maintenance dose. This titration process helps the body to adjust to the medications and helps to minimise side effects. you will keep the medication at home in a fridge. In clinical studies, patients treated with Mounjaro achieved average weight loss of approximately 15 to 20% of their starting weight over a period of 72 weeks. Individual results vary depending on dose, duration of the treatment, consistency, and lifestyle factors. Mounjaro, like all weight loss injections, can cause side effects in some people. However, these vary from person to person. As mentioned earlier, Mounjaro dosage is titrated to help minimize any side effects. The types of side effects and how long they last can vary from person to person. Very common side effects from Mounjaro include nausea, vomiting, stomach pains, and altered bowel habits. More serious but less common side effects include pancreatitis, gallbladder problems, and tachycardia. You can see here a list of conditions and circumstances where we may not be able to prescribe Mounjaro. There is currently strict criteria as to who may qualify for Mounjaro. You will need a BMI of over 35 with 4 out of 5 specific health conditions which are listed here. Type 2 diabetes, obstructive sleep apnea, high blood pressure on medication, high cholesterol, or cardiovascular disease. If you don't have 4 out of 5 of these comorbidities, our service will be unable to assess you for injectable therapy. GLP-1 based therapies are effective tools for weight management by reducing appetite and improving metabolic signalling. However, long-term success depends on combining the medication with healthy nutrition, physical activity, and ongoing medical follow-up. Even though your appetite is lower on the injectables, food quality still matters. Eating enough protein helps preserve lean muscle mass, and good nutrition helps to sustain fat loss and metabolic health. Poor food choices can limit fat loss and even worsen some side effects. Weight loss can include muscle loss if we're not careful. Physical activity is an essential component of treatment. Resistance training helps prevent muscle loss during weight loss, whilst aerobic activity improves cardiovascular health and insulin sensitivity, and also supports long-term weight maintenance. Mounjaro helps reduce hunger and supports weight loss, but long-term success depends on healthy habits. The medication is a tool. The best results come from combining medication, healthy eating, and physical activity. All three work together. In the next part of the presentation, we will talk about the surgical options offered within the weight management service at CHFT. Here, we offer 4 different weight loss procedures. 2 of these are malabsorptive metabolic surgeries, which are the Roux-en-Y gastric bypass and the one-anastomosis gastric bypass, which promote weight loss through restriction and malabsorption. The third is a non-malabsorptive procedure, which is a sleeve gastrectomy. The final procedure, which is not a surgical procedure and temporary, is an intragastric balloon. In the next few slides, we will go into more detail about each procedure. The Roux-en-Y gastric bypass is a surgical procedure and has been used as a treatment for obesity since the 1960s. It involves creating a small pouch from the stomach, which will be the size of an egg, and rerouting the small intestine to this pouch. The rest of the stomach remains inside you, but food will not go into this. The surgery will be carried out laparoscopically or keyhole. Here's a breakdown of the procedure. We will create a new stomach pouch. The surgeon divides the stomach into a small upper pouch, which is about the size of an egg, and a larger lower remnant pouch. This new small pouch is the only part that will hold food now. Then part of the small intestine is bypassed. The small intestine is then divided and the lower part is attached to the new small stomach pouch. This bypasses a significant portion of the stomach and the first part of the small intestine, which is called the duodenum. This creates the roux limb through which food will travel. And then the bypass portion of the small intestine, that is the part that is still connected to the larger stomach pouch, is reconnected further down the intestine, allowing digestive juices to mix with food later on. So what does this mean? It will restrict your food intake. Because the stomach pouch is very small, it restricts the amount you can eat and will make you feel full quickly. It will reduce nutrient absorption. Since part of the small intestine is bypassed, fewer calories and nutrients are absorbed, which can help with weight loss. There will also be hormonal changes. The surgery affects gut hormones that influence hunger, fullness, and blood sugar control, further aiding weight loss. The benefits to the Roux-en-Y gastric bypass are that you could expect to lose up to 70% of your excess body weight. It's effective in terms of long-term weight loss. And also you may see an improvement or resolution of type 2 diabetes, high blood pressure, and other health conditions. All surgeries carry risks, and here are some of the risks involved specifically with the Roux-en-Y gastric bypass. You'll be provided with further written information after you have attended one of our group education sessions. Anastomotic leak. This is a serious complication that may happen if any of the joints fail to heal, leaving a hole. Pouch stenosis. This is when a joint between the new stomach pouch and small bowel tightens. This can cause reflux, vomiting, blockage, and difficulty swallowing. Developing a hernia inside your abdomen caused by part of your bowel becoming trapped or twisted. This can lead to bowel obstruction and you may need another operation. Staple line bleeding. You may experience nutritional deficiencies due to malabsorption. You may experience dumping syndrome, which is rapid stomach emptying, causing nausea, dizziness, and diarrhea after eating sugary foods. The one anastomosis gastric bypass, also known as a mini gastric bypass, is another type of metabolic surgery for weight loss. An anastomosis means a surgical connection between two structures. As the name indicates, with this procedure, only one connection between the stomach pouch and small intestine is made. How does it work? The surgeon creates a small pouch from the upper part of the stomach. This pouch restricts how much food you can eat. Then, instead of connecting the pouch to the small intestine in two places, like the traditional Roux-en-Y gastric bypass, the surgeon connects the pouch to a loop of the small intestine at just one site, hence the name one anastomosis. This single connection bypasses a part of the small intestine. As with the Roux-en-Y gastric bypass, the one anastomosis gastric bypass restricts food intake. Because the stomach pouch is very small, it restricts the amount you can eat and will make you feel full quickly. It reduces nutrient absorption. Since part of the small intestine is bypassed, fewer calories and nutrients are absorbed, which can help with weight loss. There will also be hormonal changes. The surgery affects gut hormones that influence hunger, fullness, and blood sugar control, further aiding weight loss. The benefits of the one anastomosis gastric bypass are that you could expect to lose up to 70% of your excess body weight. It is effective for long-term weight loss. You will see improvement or resolution of type 2 diabetes, high blood pressure, and other health conditions. It has a shorter surgery time than the Roux-en-Y gastric bypass, and there is a lower risk of certain complications due to one surgical joint. As with the room-wide gastric bypass, there are risks with a one anastomosis gastric bypass. As already mentioned on the previous slides, there is a risk of an anastomotic leak, pouch stenosis, herniation, staple line bleeding, nutritional deficiencies, and dumping syndrome. In addition, there is a risk of bile reflux because the loop allows bile to sometimes flow back into the stomach, which may make it unsuitable if you have a pre-existing reflux issues. A sleeve gastrectomy, also referred to as a gastric sleeve, is a surgical weight loss procedure that involves the removal of a large portion of the stomach, creating a narrow tube that resembles a banana-shaped sleeve. This procedure has been used since 2008 and reduces the stomach's capacity by around 75 to 80%, limiting food intake and promoting a feeling of fullness. Unlike the room-wide gastric bypass and the one anastomosis gastric bypass, the rest of the gastrointestinal tract remains unchanged, so is a non-malabsorptive procedure. With the sleeve gastrectomy, your potential weight loss could be around 60 to 70% of your excess weight. So how does this work? It reduces your stomach size, so limits food intake, which leads to reduced calorie intake. It also impacts hormones that regulate blood sugar and metabolism. It has an impact on hunger. The part of the stomach that is removed produces a hormone called ghrelin, which is responsible for stimulating appetite. With less ghrelin being produced, many patients report feeling less hungry after the procedure, which can make it easier to stick to a healthier eating plan. The benefits of the sleeve gastrectomy are that it doesn't involve rerouting or bypassing any part of the intestine, so it's a simpler procedure than a gastric bypass. Since it's a restrictive surgery, it doesn't alter nutrient absorption, which reduces the risk of some nutritional deficiencies that can occur with other surgeries, such as the gastric bypasses. Again, with a sleeve gastrectomy, there are a risk of complications, which include staple line bleeding, staple line leak, a sleeve narrowing, which is also known as a stenosis, and developing acid reflux. It is important to mention that all three surgeries mentioned so far require adherence to dietary recommendations, lifelong vitamin and mineral supplementation, commitment to lifestyle changes, and follow-up compliance. In certain circumstances, usually if your BMI is deemed too high for anaesthetic, it may be possible to have an intragastric balloon, whereby an inflatable silicone balloon is inserted into your stomach. It works by limiting the stomach's capacity and slowing down the process of digestion. You will eat less and feel fuller for longer. The intragastric balloon is not a surgical procedure and is inserted into the stomach via an endoscopic procedure which is done under sedation. It is temporary and can stay in place for only up to 12 months. Although you should achieve some initial weight loss, the weight loss is not as much and is slower compared with surgery. And people who have the gastric balloon are less likely to maintain weight loss than those who do have surgery. One of the main side effects of the intragastric balloon is that some people may experience nausea, vomiting, or abdominal discomfort after the balloon is placed. These symptoms usually subside after a few days to weeks. There are many things to consider when deciding which surgery may be the right one for you. But on this slide, there are some considerations. Our team will help to advise and try to ensure the most appropriate surgery for you. After bariatric surgery, you can expect a range of physical, emotional, and lifestyle changes. These will vary from person to person, but here are some general things that people experience. Please note that this list is not exhaustive. Rapid weight loss. After surgery, many people experience significant weight loss within the first 6 to 12 months. This is due to the smaller stomach size and reduced food intake, along with changes in your body's metabolism. Tiredness. Feeling tired or fatigued after bariatric surgery is very common, especially in the first few months. There are several reasons why you might feel more tired than usual after surgery, such as reduced calorie intake. After bariatric surgery, you're eating less food, so your calorie intake decreases significantly. This can make you feel tired, especially in the early stages, as your body adjusts to the reduced food intake. Nutrient deficiencies. Since your stomach can only hold a small amount of food, you may not be getting enough vitamins, minerals, and other nutrients that contribute to energy levels. Common deficiencies after surgery include vitamin B12, iron, vitamin D, and calcium, which can lead to fatigue. You will be provided with vitamins and minerals to take after surgery. You may have some sleep disruption after surgery. You also may suffer from mental fatigue. The emotional and psychological adjustments after surgery can also contribute to feelings of tiredness. It's a big lifestyle change, and dealing with new eating habits, body image issues, and emotional aspects of weight loss can leave you feeling emotionally and mentally drained. Hair loss. Hair loss after bariatric surgery is a common issue, and it typically happens within the first 3 to 6 months after surgery. This occurs due to various factors, including rapid weight loss. Losing weight quickly after surgery can stress the body and trigger hair loss. Also, the physical and emotional stress of undergoing surgery and adjusting to a new lifestyle can contribute to hair shedding. Fortunately, the hair loss usually peaks around 3 to 6 months after surgery, but tends to improve or resolve by 9 to 12 months. Dumping syndrome. Dumping syndrome is a condition that can occur after bariatric surgery where the stomach size is reduced and its ability to empty is altered. Essentially, it's a set of symptoms that happen when food, especially high sugar or high fat foods, move too quickly from the stomach into the small intestine. There are 2 types of dumping syndrome. The first one is early dumping syndrome, which occurs about 10 to 30 minutes after eating. This type happens soon after eating, usually when you consume foods that are high in sugar, fat, or simple carbohydrates. It's due to the stomach emptying too rapidly, causing a flood of undigested food into the small intestine. The body reacts to the sudden influx of food in the small intestine by releasing insulin too quickly, which can drop your blood sugar levels, which leads to symptoms such as nausea, vomiting, abdominal cramping, diarrhea, dizziness or lightheadedness, and sweating. The second type of dumping syndrome is late dumping syndrome, which usually occurs about 1 to 3 hours after eating. This type of dumping syndrome is related to a rapid release of insulin after a meal, usually due to consuming foods with high sugar content. It's a delayed reaction and tends to occur about an hour to 3 hours after eating. In this case, the body's pancreas releases too much insulin in response to the quick sugar absorption, which then causes a drop in blood sugar. The key symptoms include hypoglycemia, which is low blood sugar, and symptoms may include shakiness, sweating, confusion, dizziness and irritability, fatigue, weakness, and hunger. Lifelong blood tests. Because we want to ensure you are nutritionally optimized, we will check your bloods on a regular basis, usually coinciding with a bariatric clinic appointment. Excess skin. Excess skin after bariatric surgery is a common concern for many people who lose significant amounts of weight. After rapid or substantial weight loss, the skin may not be able to shrink back to fit the new, smaller body. This can result in loose or sagging skin, which can be uncomfortable, emotionally distressing, or even cause hygiene issues. You will receive 2 years follow-up with our team. We follow you for a full 2 years after surgery and are here to advise, help and support you through your bariatric surgery journey. Our team recommend waiting at least 12 to 18 months after bariatric surgery before attempting pregnancy. This waiting period allows your body to stabilise at a healthy weight and gives it time to adjust to the changes in nutrition, metabolism and hormones post-surgery. There are a few key reasons for this. After surgery, your body undergoes significant changes in how it absorbs nutrients. Early in your post-surgery journey, you may be at risk of nutritional deficiencies, particularly in vitamins like B12, iron, calcium and folate. Since pregnancy places additional nutritional demands on the body, it is essential that your nutrient levels are optimal before conception. If you get pregnant too soon after surgery, the rapid weight loss may continue during pregnancy, which can affect fetal development and your ability to carry the pregnancy to full term. Once you've reached a healthy, stable weight and your body has adjusted to the new way of eating, you are more likely to experience a healthier pregnancy with fewer complications. Whilst bariatric surgery can improve many aspects of a woman's health, it can also increase the risk of certain complications during pregnancy. These include gestational diabetes, preeclampsia, premature birth, nutrient deficiencies, and morning sickness. The effectiveness of birth control may be impaired after surgery and can affect how well certain birth control methods work. Oral contraceptives and patches may have reduced effectiveness after weight loss surgery, particularly if there is significant weight loss. It may be more appropriate to consider the contraceptive implant, depot injection, or insertion of an IUD such as the coil. If you do become pregnant after bariatric surgery, you must inform your midwife, who may ask you to contact our team for additional advice. We ask that after bariatric surgery you abstain from drinking alcohol. Alcohol delays wound healing and could lead to post-operative complications. If you are an emotional eater, you will no longer be able to use food as a coping mechanism after surgery. This can lead to other unhealthy behaviours such as excess alcohol consumption and addiction. Alcohol provides a lot of calories, so drinking more than occasional small amounts will mean that you will lose less weight. In any case, never exceed the maximum safe limit for health, which is 14 units of alcohol spread over a week. Alcohol can also make you feel hungry, so you are more likely to snack, especially on high-calorie foods. Alcohol will also be absorbed much more quickly than before surgery, so you may become intoxicated much easier than before. Here at CHFT, smoking nicotine-containing products is an absolute contraindication to proceeding towards surgery. And so, if you are smoking anything containing nicotine, we would encourage you to think about stopping now. Smoking can interfere with your body's healing process, impact weight loss, and increase the risk of complications. Here's why it's so important to avoid smoking after bariatric surgery. Smoking has been shown to slow down the body's ability to heal. After bariatric surgery, your body needs to recover from the procedure and heal the surgical sites. Nicotine and other chemicals in tobacco can reduce blood flow. Smoking constricts blood vessels, leading to reduced oxygen delivery to tissues, which impairs healing. This can increase the risk of wound infections and delayed wound healing. Smoking after surgery can increase the likelihood of infection, wound opening, which is called dehiscence, or poor scarring. It can also contribute to gastric leaks and other surgical issues. Bariatric surgery changes the digestive system, often limiting the body's ability to absorb nutrients effectively. Smoking can make this problem worse by affecting digestion. Smoking has a negative effect on the digestive system and can contribute to issues like gastritis, which is inflammation of the stomach lining, which may make it more difficult for the body to properly digest and absorb nutrients. Smoking also increases the risk of developing blood clots, which can be dangerous after any surgery. The risk is even higher with bariatric surgery, where the body is already under stress from the procedure. Deep vein thrombosis, or DVTs, or a pulmonary embolism, a PE, can occur, both of which are life-threatening. Smoking can make blood clotting more likely, increasing the chances of complications. While some people smoke to suppress appetite, nicotine may lead to increased cravings for unhealthy foods after surgery. It can also interfere with your ability to develop healthy eating habits, which are crucial for long-term success. As we have already said, bariatric surgery dramatically decreases the body's ability to absorb vitamins and nutrients. Because of this, after bariatric surgery, you'll be discharged from hospital with a multivitamin and mineral, a calcium and vitamin D supplement, an iron supplement, and omeprazole or lansoprazole. These will be provided by the hospital pharmacy, and all will be in liquid, dispersible, or a crushable form for the first 4 weeks after surgery. You will also be sent home with blood thinning injections, which you will need to self-administer at home for 28 days after surgery. In addition, you will need to have a 3-monthly vitamin B12 injection at your GP, which is required lifelong after surgery. In most circumstances, your GP will continue these medications on prescription. There is a financial consideration, as you will be expected to buy your medications on prescription, or if your GP will no longer prescribe, will have to be bought from your chemist or online. You may want to consider buying a prepayment certificate, which will save money if you need more than 3 items in a 3-month period or 11 items in a 12-month period. You can buy the prepayment certificates online or in person at some pharmacies.
After surgery, you will need to commit to taking a vitamin and mineral supplementation for life. There's 2 reasons why you need to take this medication. For both surgeries after a gastric bypass or a sleeve, you will be eating much smaller quantities of food, and that might mean that you can't get the variety of nutrients in your diet. If you're having a gastric bypass, we also have the malabsorptive element. So we will be bypassing the first part of your small bowel. You can see on the diagram the duodenum, which is the first part of the small bowel where we absorb calcium, iron and other nutrients. So you will need to take a B12 injection every 3 months from your GP for life. You will take a multivitamin and mineral supplement daily for life, calcium and vitamin D, 2 tablets per day for life. You may need to take iron, but we will assess this regularly depending on the results of your blood test. And you will also need to purchase an over-the-counter vitamin D supplement, which you'll take daily for life. So it's quite a significant amount of tablets that you'll need to be taking, and it's also a cost that you need to commit to. At the moment, they are available on prescription from your GP, but that might not always be the case. So you need to be aware that you may need to purchase these in the future. I have put on a list of consequences of not following the prescribed supplementation, and some of them do sound quite scary, such as irreversible nerve damage. However, as long as you take the prescribed vitamins and mineral supplements, there's absolutely no cause for concern. We will be checking your bloods at 3, 6, 12, 18 and 24 months. So if there's anything, any deficiencies, we'll pick up on them very quickly and correct them. But you need to be compliant with blood tests and the supplementation. The next few slides, we're going to look at BMI, weight, and weight loss expectations after surgery. BMI is the medical terminology for the ratio of your weight to height. The healthy range is between 20 and 25 kilograms per metre squared. The higher the BMI, the more likely you are to develop weight-related conditions and complications such as high blood pressure, diabetes, heart disease, gallstones, arthritis, and even some cancers. Most people that are referred for surgery are in the red category, and after surgery will move down to the overweight sections. This will improve your overall health, reduce the risk of developing these conditions in the future, and hopefully reduce the need for medications. After surgery, we will expect that you will lose around 60 to 80% of your excess body weight, depending on the type of surgery that you've had. To calculate your excess body weight, we look at the weight you are now minus the weight you would be if you had a BMI of 25. We've got an example below that shows if you were to weigh 159 kilos or 25 stone, your BMI is 47.5. This means your ideal weight would be 75 kilograms and your excess body weight is 84 kilograms. So we would expect that you'll lose between 60 and 80% of the 84 kilograms. Some people will lose more and some people will lose less. It depends on how you work with the surgery and if you follow the dietary advice that we give you. So the table shows if you were to lose 60% of your excess body weight, if weighing 159 kilos, you would lose 50 kilos, your new weight would be 109 kilos and your BMI would be 32.5. If you lose 70% of your excess weight, you would lose 59 kilos, your new weight would be 100 kilos and your BMI would be 29.8. If you lose 80% of your excess weight, you would lose 67 kilograms, your new weight would be 92 kilograms and your new BMI would be 27.5. When you come to your first dietitian appointment, we can calculate this for you if you'd like and set a weight loss goal. However, not everybody wants to set a weight loss goal and that is absolutely fine. We are going to move on now to start talking about diet and dietary changes that you can make. However, before we do that, it's really important that you can ask yourself and be really honest with yourself, what is my eating really like? In order to make changes, it's really important that you can identify your own pattern of eating and find out what your problems are in order to make changes. We are going to look at the different types of overeating, and usually most people can identify 1 or 2 points that relate to them. Firstly, overeating and then starving. This is a habit that we commonly hear from patients, so you might go all day without eating and then by the evening you feel starving, you eat large portions and then pick all night because your body is hungry. If you skip meals, you are more likely to lose control, crave sugary foods and make more impulsive decisions when you are hungry. Eating more regularly has been proven to reduce emotional and binge eating behaviours. There is a common misconception that eating more regularly leads to weight gain, but actually after surgery, those who eat regularly are more likely to keep the weight off. Emotional and stress eating is also common. We know that our relationship with food and the reasons why we eat can be very complex. We do not just eat because we are hungry, and it can be used as a form of comfort in times of stress or distress. This is something that you really need to think about before surgery, as the surgery will not address the underlying cause for this behaviour. In the short term, you will not be able to use food to cope with your emotions, but in the longer term, if you continue to comfort eat, it could lead to weight regain. We will discuss this in the first dietitian appointment, and it may be that we refer you to the psychologist for some support around alternative coping strategies. Binge eating is when you eat a large quantity of food in a short space of time. You might hide this behaviour from friends and family and feel a loss of control. This is something we would need to discuss one-to-one and again consider a referral to the psychologist for additional support. Grazing is when we take small amounts of food frequently throughout the day between standard meal and snack times. It's usually in a response to cravings, boredom or other emotions. Again, these eating behaviours will not be stopped by the surgery. Picky eaters and grazers do not eat traditional meals and often will take in more calories than if they ate 3 standard meals per day. After surgery, we will need to eat 3 small meals and no snacks, so you will need to change this eating behaviour or you will likely see weight regain. Often we use food as a reward. It might be that you have survived the week or a partner or a loved one treating you with inappropriate foods, and it can be difficult to say no. After surgery, the foods that we often use as a reward, such as crisps, chocolate, and alcohol, will not be suitable, and when eating out, you will only be able to have small portions. Now is the time to find a new type of reward that is enjoyable for you, such as shopping, going to the theatre, or getting your nails done. If you are the type of person that puts others first, it might mean that you are eating what is left over, cooking meals that are not really what you want to eat or not suitable for your weight loss goals. At this point, you may or may not have a good awareness of what your eating behaviours are. It can be really useful to keep a food diary and be really honest with yourself, but also consider why you're eating. For example, asking yourself if you feel hungry, or are you eating out of boredom or because you are upset? Some bariatric centres will ask you to lose weight before surgery. They might set you a target of 5 to 10% weight loss or ask you to follow a specific diet. We don't do this at Calderdale and Huddersfield because we know that you've struggled with your weight for a long time, and that's why you've been referred into our service. We do, however, ask that you don't gain any weight. If you do gain weight, then it may mean that your surgery is cancelled. When you were first referred to us, we will have been provided with a weight, which we refer to as your booking in weight, and we ask that you do not go above this. At your first dietitian appointment, we can discuss what your booking in weight is. Although we don't ask you to lose any weight before surgery, we would strongly encourage you to make some dietary changes and help develop some good habits prior to surgery, as this will make it easier for you in the long run. We also know that it decreases the size of the liver, which makes the operation easier. It can lead to possible shorter length of hospital stay, reduces operation times, and it demonstrates to us that you are motivated and committed. The next couple of slides are going to talk about healthy eating habits and what a balanced diet looks like. So we really encourage you to make sure that you eat breakfast and have 3 regular meals a day. We know that there's evidence that people that eat breakfast and eat more regularly eat less calories over the day and lose more weight. We don't want you to go longer than 5 hours without eating. And after a meal, if you do feel like you want to have something to eat, wait 2 hours, and if you are hungry, then eat. If you are not hungry outside of meal times, then do not eat. We do suggest that you still include a small amount of treats in your diet, and this is because we know that when foods are labelled as forbidden or completely not allowed, then we know that it can lead to binging and eating more of these foods in the long run. So still include some small amounts. It's also really useful to monitor your food intake. We know that everybody underestimates how much they eat, and this can be between 10 and 40%, and it's done subconsciously. So it's a good idea to keep a food diary, be really honest with yourself, and also consider why you're eating. Is it habit? Is it boredom? Is it emotion? Or are you actually hungry? This is the Eat Well guide, and it demonstrates what a healthy, balanced diet should look like for you now before you've had the surgery. So we've got the yellow section, which is our starchy carbohydrates, so bread, rice, pasta, cereals, and this is what provides our body with energy, and it's about 1/3 of the plate. Then we have our fruit and vegetables in the green section, which again is about 1/3 of the plate, and this is where we get our micronutrients from. The pink section is our protein foods, and this is what our body uses for growth and repair. So we have eggs, beans, meat, fish, pulses in this section. The blue section is our dairy or plant-based alternatives, and these provide our body with calcium, which we need for strong bones and teeth. And we recommend that you have 3 portions of calcium-rich foods per day. So that would be matchbox-sized piece of cheese, a yogurt, or a glass of milk. The small purple section is for oils and fats. So we do need some oils. They are essential to us, but we only need them in very small amounts. Obviously, your plate is not going to look like this at every meal time, but this is the kind of balance that we're looking for over the day or over the week. In the bottom left corner, you can see that there are crisps, biscuits, chocolate and ice cream, and these have been removed from the plate because they're not essential for a healthy, balanced diet. So that's not to say that you can't ever have them, but it just means to have them in smaller amounts and have them less often. But you can still enjoy these foods. As you can see, the plate looks quite different after surgery. You will have around 50% of your plate with protein-rich foods, 20 to 25% with starchy carbohydrates, and 25 to 30% with fruit and vegetables. We focus on protein after surgery to ensure that you maintain your lean muscle mass and lose your fat mass. You will be aiming for around 60 to 80 grams of protein per day, which can be challenging initially, and we will provide you with some written information to help you get enough protein in your diet. After surgery, you will need to separate food and fluid. This means that you can have a drink, but then you must wait 30 minutes before having something to eat. After eating, you must wait another 30 minutes before having a drink, and this is a lifelong change that you will need to make. Initially after surgery, you will feel very uncomfortable if you try to eat and drink at the same time, or it may cause you to vomit. In the long run, if you eat and drink at the same time, it will flush the food out of your pouch more quickly. It will make you feel hungry more quickly and may mean that you eat more and regain the weight that you have lost. After surgery, you cannot have fizzy drinks. Again, this will be very uncomfortable if you try to have fizzy drinks after surgery. And in the long run, it will stretch your pouch. You cannot have any alcohol, which has already been discussed. In the long run, we are aiming for 3 small protein-rich meals per day. It is important that you chew your food well and eat slowly. We suggest that you follow the 20-20-20 rule. This means having very small 20 pen-sized pieces of food, chewing 20 times, putting your cutlery down for 20 seconds in between mouthfuls, and not eating for longer than 20 minutes. If there is still food on your plate after 20 minutes, then you should stop eating, as it can take 20 minutes for your brain to communicate with the stomach that you are feeling full. Reading food labels can be confusing, and sometimes manufacturers do this intentionally to make their products appear healthier than they are. We are going to talk about what to look for on the food labels to help you make healthier choices. An easy way to identify if a food is healthy is using the traffic light system that is on the front of some packaging. If a food has mostly green labels, then this means it is a healthier choice. Try to avoid foods that have lots of red labels and only eat these foods occasionally. The traffic light system is based on the amount of fat, saturated fat, sugar and salt per 100 grams. If it does not have a traffic light system on the packaging, then you can look on the back at the nutritional information. So for example, if we chose something with 20 grams of fat per 100 grams, we can see from the table that this would be red for high in fat. If we chose something with 12 grams of sugar per 100 grams, we can see from the table that this would be orange for medium sugar. When you're comparing two products, you can either use the traffic light system or the nutritional information per 100 grams. When you compare products per serving or per calories per serving, this can be misleading, so I would avoid doing this. It is important to consider what is a portion and what is a serving, as this can also be misleading. Often the serving suggestions from the manufacturer is much smaller than the serving size we would actually eat, so at first glance when you look at the calories in a serving, it can be misleading. For example, if you cut a cake into 6 pieces, but the manufacturer recommends it is cut into 12 pieces, the calories per serving is double what the manufacturer states. Another way to consider if a food is going to be healthy or unhealthy is to look at the ingredients list. The ingredients are listed in the order from most to least. So if butter, oil, sugar are first in the list or very high up on the ingredient list, then this means that this is one of the main ingredients and this will not be a healthy option. Another misleading tactic that manufacturers do is to label things as reduced fat or no added sugar. This does not mean that it is low fat, simply that it has less fat than the original version. If the product says no added sugar, it does not mean that it is sugar-free. When reading food labels, also try to look out for things such as honey, coconut sugar, glucose, dextrose and syrup, as these are all another way of saying the food contains sugar. The importance of a good sleep routine and getting sufficient sleep is often underestimated. It is well known that those with poor sleep or those who sleep less than 6 hours a day are more at risk of weight issues and emotional eating. Poor sleep disrupts the impact of our hormones ghrelin and leptin that signal when we are hungry and full. This leads to an increased hunger, especially for high-calorie foods. Those with poor sleep are more likely to snack than have conventional meals, leading to higher energy intakes overall. Poor sleep is closely linked with emotions such as stress and anxiety and may increase the incidence of emotional eating if that is something that you already struggle with. So try to prioritise sleep and have consistent sleep and wake times.
The liver reduction diet is a diet based on low energy or calories, in particular low in carbohydrate and fat. By following a liver reduction diet, your body will be forced to use up the stored carbohydrate known as glycogen from the liver. The glycogen and a quantity of water will be metabolized from the liver, and therefore the liver will shrink, become softer, more flexible, and easier to move during surgery. During laparoscopic or keyhole surgery, the liver has to be lifted out of the way to access the stomach lying beneath it. Most people needing bariatric surgery have a large fatty liver, which can cause difficulty for keyhole surgery. A large or fatty liver makes it harder for the surgeon to see and gain access to the stomach underneath. This can increase the duration of your surgery and therefore your time under general anesthetic. If you do not follow the liver shrinkage diet and your liver has not shrunk, surgery may be deemed unsafe and the surgeon may cancel the surgery on the day. The preoperative liver reduction diet booklet will be provided to you at your initial dietitian appointment. It is a strict diet that you will be required to follow for 3 to 4 weeks before your surgery. The liver reduction diet consists of a low carbohydrate, low fat diet and is a total of 800 to 1000 calories per day. The diet plan will be provided to you with a choice of food on a 3-meal per day plan, or alternatively meal replacement shakes, or whichever fits into your lifestyle the best way. As you lose glycogen and water from your liver, you will lose body weight at a rate of between 5 to 10 kilograms or 11 to 22 pounds over the 3 to 4 weeks immediately prior to surgery. It is important that you do not have a large last meal the night before your surgery, as this can undo the good work you have done in shrinking your liver size and could impact on the safety of your surgery. If you have diabetes and are on tablets or insulin, it may be necessary to adjust your medications as you start the liver reduction diet. You will be guided on this by the bariatric team. The next few slides will look at what the dietary recommendations are after bariatric surgery and what your daily diet and portion sizes may include. Irrespective of whether you have a sleeve gastrectomy or a gastric bypass, the dietary recommendations are the same. Stage 1. You will be allowed to have sips of fluids 4 to 6 hours after surgery when you return to the ward. Stage 2. After 24 hours, you should expect to start on a puree diet, which is a smooth texture containing no lumps. If eating puree feels comfortable after about 4 weeks, you may then progress on to stage 3, which includes soft mashable foods. You may then move on to including some crunchy textures such as crisp breads. This stage is recommended for 4 weeks while your surgery continues to heal. Stage 4. A normal texture diet can often be tolerated after 8 weeks of surgery. At this point, you should be able to manage 3 small meals per day on a side plate, portion plate, or small bowl. It is important to note that we all heal at different rates. Some people may progress a little slower than how I have described. Stage 1. You will be allowed to have sips of fluids 4 to 6 hours after surgery when you return to the ward. If you can tolerate sips of water, you will then be offered tea, coffee, or sugar-free juice, and aim to drink slowly at a maximum of 100 to 200 ml each hour. Stage 2. After 24 hours, you should expect to start on a puree diet on the ward. This is a smooth texture containing no lumps. Immediately after your surgery, there is a lot of swelling and inflammation around your new pouch. When you start a puree diet, you will only manage 2 or 3 teaspoons before you feel full. It is important that you stop eating as soon as you become full so that you do not vomit. By the end of the first week, you will be able to manage around 10 teaspoons comfortably at each meal time, and over the next week or so, build up to a portion size of around 3 tablespoons of puree at around 5 to 6 times per day, until you are around 4 weeks after surgery. Suitable puree foods include Weetabix, Ready Brek, porridge, soup, high-protein yogurts, or hand-blended meals such as stews. If eating feels comfortable at this stage, you may then progress on to stage 3. Stage 3. Soft mashable foods from 4 weeks whilst your surgery continues to heal. You should be able to mash your food with a fork at this stage so that it may contain small lumps of food. You may need additional low-fat sauces or gravies to make the food easier to swallow. You need to chew well and eat slowly. Examples of suitable foods at this stage include scrambled egg, shepherd's pie with gravy, crisp breads, and low-fat cream cheese. If you find you are able to eat more than 3 to 4 tablespoons at each meal, reduce the frequency of your meals at this stage to 3 per day and try to avoid any snacking. After 4 weeks of stage 3 foods, you may now be ready to move on to stage 4, which is a normal texture diet. This can often be tolerated after around 8 weeks after surgery. At this point, you should be able to manage a little more volume at 3 meals per day. Serve these on a side plate, portion plate, or small bowl. Breakfast could be 1 Weetabix or a small bowl of another healthy cereal. Lunch and evening meals should be served on a side plate and contain a small portion of carbohydrate such as bread, potato, pasta or rice. Half the meal should be a high-quality protein food such as meat, chicken, fish, egg, tofu, corn or soya protein, and a small portion of veg. Remember the 20-20-20 rule: 20 chews of food, 20 forkfuls, and not let the meal last for more than 20 minutes to ensure you are not overeating. The recommended dietary principles to help you to be satisfied and comfortable with your food intake and also to attain the maximum weight loss are to eat slowly, place your fork on the plate for 20 seconds between bites and aim to chew each mouthful 20 times. This will ensure that food does not get stuck in your new pouch. Use small plates and bowls. This helps with portion control and is also a psychological trick to make you feel full when you've eaten a small amount. Stop eating as you start to feel satisfied and not overfull. Choose the correct food texture for your stage of healing. Avoid carbonated drinks as these can cause pain after your surgery. Avoid alcohol due to its excess calories and risks of addiction transference after surgery. And avoid too many fresh fruit juices which contain excess natural sugars and can cause dumping syndrome. Remember to keep food and fluids separate. If you drink with meals, you'll flush food through your pouch and will not feel full as long and therefore likely to eat more. Don't eat whilst doing other things and try and concentrate on eating. Avoid reading, using the computer, watching TV or driving. If you eat when doing other things, you will lose track of the amount you have eaten and not focus on chewing. Remember the healthy eating principles. Sugar and fat are concentrated sources of energy, so you will need to limit these as much as possible. You need lots of protein to help your wounds to heal after the surgery and to maintain as much muscle mass as possible. Plenty of fibre to keep your bowels going, and some starchy food each day as a source of energy to fuel your body. Vitamins and minerals are very important to keep the processes in your body working well, and remember to check food labels. Remember the 20-20-20 rule. 20 chews, place your fork back down on your plate between each bite for 20 seconds. 20 pence piece size amounts of food in your mouth each time, and don't let your meals last for more than 20 minutes. This will ensure you are not overeating at your meal times. After bariatric surgery, there are a few common foods which may cause pain, discomfort, or even vomiting after eating. Everyone experiences this differently, and it is hard to predict what you will or will not be able to eat after the surgery. Common problem foods can include bread, which may be better tolerated when it is toasted. Often whole grain breads are better tolerated than white bread, or alternatively crackers or crisp breads are usually well tolerated. Pasta can cause problems for some patients. If this is the case, then you can buy small pasta shapes designed to make soups, and these are often better tolerated than large pasta pieces. If you find you struggle with meat, chicken or fish after your surgery, it is common for these foods to be better tolerated if they are in very small pieces or cooked in a liquid or sauce, such as a stew or curry. Some patients find that rice is better tolerated, again if it is moist in a risotto or hidden in another sauce such as curry. Vegetables tend to be better tolerated if they are overcooked initially. Raw vegetables may not be tolerated for some time. Certainly in the early weeks after surgery, fruits such as oranges, apples and tomatoes can be difficult to digest. Fruits which can be peeled easily like a banana or stewed or canned in juice are often better tolerated. The pathway to bariatric surgery starts from the moment of referral into the bariatric surgical team. What you are watching and listening to today is the Bariatric Surgery webinar produced by the Calderdale and Huddersfield NHS Foundation Trust Bariatric Surgical Team to outline the surgeries, service and recommendations to achieve successful long-term safe weight loss after bariatric surgery. The first face-to-face appointment you will receive is for the group education session, where you will be invited in small groups with other patients who are also exploring bariatric surgery to improve their health. At this webinar, it will give you the opportunity to speak with members of the bariatric team and to ask questions. We like to keep the sessions as informal as we can to allow you to feel comfortable so that we may assist you with your queries. After the group education session, you will be encouraged to contact the bariatric coordinator to book onto a bariatric support group. These sessions are usually held face-to-face and are for all people, both before and after surgery, to access support through your bariatric surgery journey. Again, these are small groups of people at different stages in the bariatric pathway. We often ask a patient who has recently had surgery to come and speak about their journey so far. People often report that they find it helpful to gain support from other patients in addition to the bariatric surgical team members. After attending support group, several other healthcare tests and appointments are requested for you at this stage. These appointments and tests may come through in varying orders for different people, but everyone will receive a dietitian appointment, which will include an assessment of your medical history, weight history and food intake, hopes and fears around the surgery, and also provide dietary advice for both before and after surgery to ensure you get the very most out of your bariatric surgery. The dietitian can also help you to make the decision about which surgery type would be the best for you if you are unsure. Other tests which all patients have are an endoscopy, where a small camera is placed into your esophagus and stomach to ensure it is healthy. It is essential that we know this before we go on to operate on your stomach. All patients will also have a sleep study to check for a condition called obstructive sleep apnea. This is a condition where you can stop breathing many times during your sleep. If you know you have had a recent endoscopy and have obstructive sleep apnea, then please inform the bariatric team on the day of your group education meeting, so we do not arrange for this test for you again. After seeing the dietitian and attending for the endoscopy and sleep apnea test, the next appointment will be with a bariatric surgeon who will do a health assessment and help you to decide ultimately which bariatric surgery is recommended for you to gain maximum health benefit. Once you have seen the surgeon, you will be listed for discussion at the bariatric team's multidisciplinary meeting, where all parties will decide whether they agree that the surgery you have chosen is both appropriate and safe for you. At this point, you will be added to the waiting list for your surgery. Once you have been contacted about your surgery date, which is often a few months later, you will be invited to the hospital to attend for a pre-assessment appointment and a further dietitian appointment, where the liver reduction diet will be discussed with you in more detail. After this, it is the main surgery day, where you will be looked after by the bariatric team until your discharge from hospital, which is usually the day following your surgery. Bariatric surgery is a very effective weight loss treatment for those who are living with obesity. For the best outcomes, exercise plays an important role in building muscle, improving metabolism, and keeping excess weight off. People who have low activity levels can improve their fitness within as little as 4 weeks by taking regular exercise. This gives you an opportunity to get fitter before your operation and improve your chances of a better and quicker recovery after surgery. The main purpose of exercise is to preserve as much muscle mass as possible while you are losing fat after bariatric surgery. It can help to track your activity levels either in a diary or an app, and aim to increase this monthly or weekly. You should aim to do 150 minutes of moderate intensity activity per week, for example walking. Spread the exercise evenly over 4 to 5 days per week or a little every day. It is beneficial to do strengthening activities that work all the major muscle groups, such as legs, hips, back, abdomen, chest, shoulders and arms, on at least 2 days per week. Reduce the time spent sitting or laying down and break up long periods of not moving with some activity. Make sure your activity and intensity are appropriate for your fitness and try to choose exercise which you find to be fun. There is sufficient follow-up from the bariatric team after your bariatric surgery to ensure your queries are answered and that you are keeping healthy. The pathway after your bariatric surgery typically starts the day after your surgery, when either the bariatric specialist nurse or a dietitian will come and review how you are feeling on the ward before your discharge home is planned. We aim for patients to go home the day after surgery, but if you do not feel that you are ready or you live out of our local area, we may encourage you to stay for a second night. You will expect to receive a telephone call from a member of the bariatric team approximately 1 week after your surgery. All other appointments are face-to-face in a bariatric clinic, which we aim to see you at around 6 weeks after surgery, 12 weeks, 6 months, 12 months, and then for a final appointment at 2 years post-surgery. At this appointment, the aim is for you to have reached all your healthcare goals and be nutritionally stable to be able to discharge you back to the care of your GP. If you are unwell or have queries in between these appointment dates, we encourage you to ring the bariatric coordinator, where additional contact points will be arranged as needed. There are many decisions to be made with regards to whether bariatric surgery is the right choice for you, and you may still be feeling unsure. Questions to ask yourself before making a decision about whether you want to go forward with bariatric surgery, or indeed which bariatric surgery you feel will give you the most health benefit, are included on the slide. Important things to consider are if you are prepared and will remember to take the daily multivitamins and minerals, which are required lifelong after all bariatric surgeries. Do you have any other health comorbidities which may improve with weight loss or may impact on which surgery is going to be the most appropriate? Have you attempted all other available weight loss measures? If you have not, I would strongly recommend that you have exhausted dietary modification plans before taking the decision to have bariatric surgery, which will affect the way that you eat for the rest of your life. Are you committed to attending the hospital for the 2-year follow-up? It is essential that we see you after this surgery and test your blood levels to ensure you are not developing any deficiencies or becoming unwell. What are your eating patterns? Do you tend to eat sweet foods or graze during the day? Do you commonly binge eat, or are you an emotional eater? These will all impact on which surgery is going to be the best for you, and a referral to the bariatric psychologist may be offered if you feel that you have a strong emotional bond with food, which affects how and what you eat each day. The success of your surgery will be greatly improved if you are able to change your behaviours and lifestyle factors which have contributed to weight gain and referral into the bariatric service. All the surgeries will require you to change your dietary habits. Please ask yourself if you are prepared to change and choose new foods, new textures, and new ways of eating. If you feel that this is going to cause some difficulty, please discuss this with the dietitian at your appointment, as bariatric surgery is not suitable for everybody. Finally, have you stopped smoking? If you are using an e-cigarette, does it contain liquid without nicotine? Nicotine causes problems with wound healing after surgery, and we cannot progress you to surgery until you are nicotine-free.
Thank you for listening to this webinar. Please feel free to email or telephone the team if you have any queries. If you scan the QR code on this slide, it will take you to the weight management webpage where you will be able to access more information about our service, the team, and useful resources, including copies of the diet sheets. We look forward to meeting you at the weight management group meetings and supporting you in your weight loss journey.